All right, let's move on to case number 5. Float like a butterfly. It was submitted by Caitlin Keenan, a pediatric emergency medicine fellow from Cohen Children's Medical Center. That's in Queens, New York. It was submitted with Robert Gochman. It's a healthy 18-month-old male who presents with a complaint of a growing, painless umbilical mass over the past 2 days. Parents deny any redness or drainage from the mass. He's afebrile, he's well-appearing, he's playful. This is the picture of the umbilical mass. I'm going to zoom in. What is that? So what's the diagnosis? Is it A, umbilical polyp, B, umbilical granuloma, C, urachal adenocarcinoma, D, an umbilical arthropod, or E, a urachal abscess? Answer is D. It's an umbilical tick. So the mass was identified as an engorged tick attached to the patient's umbilicus that was removed via the knot suture loop technique without any complications. Here's how they did it. Look at that little guy. So the knot suture loop technique, you tie a simple knot over the tick's head as close to the skin surface as possible with suture, like 1/0 silk. You can use that for anything else anyway. You gently close the loop so that the knot tightens around the tick's mouth parts. You pull the ends of the line slowly and steadily as the tick is eased out of the skin. Avoid tightening the knot sharply and you're going to decapitate the tick, and you'll leave it part of it like its mouth parts embedded in the skin. There's another technique which involves forceps, which does involve the risk of crushing the tick and leaving the mouth parts in the skin. After removal, thoroughly clean the bite area with rubbing alcohol or soap and water. All right, Lyme disease. You're all thinking about it, right? Do you treat this kid? So it's the most common tick-borne illness in the United States. It's caused by Borrelia burgdorferi bacteria transmitted via the bite of an infected ixodes tick. The risk of transmission of Lyme disease occurs after 48 hours of tick attachment. Early localized disease, 2 to 3 weeks. That's the erythema migrans rash. Early disseminated disease, weeks to months. Multiple EM, flu-like symptoms, cranial nerve palsy, meningitis, and carditis. Late disease, mono or oligoarticular arthritis, usually of the large joints such as the knee. There's no such thing as chronic Lyme. So, what would you do to this kid? Well, did you identify the tick as an ixodes tick? Was the duration of attachment greater than 36 hours? Well, then if that's the case, you could start prophylaxis if it's within 72 hours of tick removal.